I want to talk about something tonight that was not accomplished. And it was not accomplished in this vote we just had, which was a continuing resolution that keeps the government funding for a little while longer into January. Some of us had pushed hard to include various things in this legislation. And I understand that some of these items are controversial, and it was hard to get it done because you needed 60 votes tonight. You needed a bipartisan consensus, really, on how to move forward, not to shut down the government. And I am not a fan of government shutdowns. They don't work. They're inefficient. They cost the taxpayer more at the end of the day. They cause a lot of pain in the process. But I will tell you, we had the opportunity to pass certain things tonight that were not controversial. And I don't understand why we didn't do it. Some issues, again, I understand, on the spending front were more controversial. I understand some issues were more controversial in terms of how you deal with the immigration issue. The DACA issue is one that I support us resolving. I think we should codify it and resolve that. But I understand there were different points of view. People wanted to add different things there. But let me tell you about one where I don't think there was any disagreement. And if we could have passed it tonight, it would have provided a lot of certainty and predictability to families in Ohio and around the country. It's one that passed my committee, the Finance Committee, by a strong vote, not a bipartisan vote, but a unanimous vote. And that's the Children's Health Insurance Program, the CHIP program. We passed it with a unanimous vote at a committee. People say, well, but we need to find pay-fors for it. Well, it is about $8 billion to do what we did, which was a 5-year extension of the program, providing, again, certainty and predictability to families who tonight are wondering what's going to happen. What's going to happen to this program? Are my kids going to have the kind of quality health care that they can access through the Children's Health Program, the CHIP program? But I'll tell you, there are some pay-fors out there that are, again, bipartisan. A big one, which would cover nearly half of that cost, is one where you simply ensure that the Medicaid program has more integrity so that if a third-party payer is paying, then the Medicaid program doesn't pay. It's always been a bipartisan initiative. It's a pay-for that, again, we've looked at for this program. It would have been one we could have used. So I don't get this notion that we couldn't pass it because we couldn't find the pay-fors. The pay-fors were there. And I don't get it that this was controversial, because it's not. I believe that on both sides of the aisle, we wanted to resolve the Children's Health Insurance Program. And again, with all the other issues, I understand. It's tough when you've got to get the 60 votes and have to get this passed in order to keep the government operating, which is not a situation we should be in, but we're in. But I must tell you, I am very disappointed that we were not able to deal with this one issue tonight that has not been controversial, that came out of the committee with a unanimous vote. Not bipartisan, but unanimous. CHIP now helps 219,000 Ohio children get the health coverage they need, and 9 million children nationwide. Ohio's got the 10th largest program, and CHIP has been a leading cause in driving the uninsured rate down for Ohio kids. In the case of my home state, we've seen our CHIP funding be questioned because the program was authorized until the end of September. Now it's no longer authorized. So we're not sure exactly how much money we have left. We think we have enough to get into February in Ohio. Some states, I'll tell you, are worried about even getting into January. So tonight there was a short-term extension that, as I understand it, will take the program into February. But again, it doesn't provide that long-term certainty that families are looking for. And I must tell you, I'm disappointed from what I hear about the reasons, because I asked on both sides of the aisle. And one reason I got, again, from leadership on both sides of the aisle is that, gosh, we can't do it unless we do other things with it. You know, it is called CHIP, C-H-I-P, Children's Health Insurance Program. But it shouldn't be a political chip. It should be taken out of politics. It should be something that we deal with separately. So I will just tell you that using it as leverage for other programs is not the way I'm going to look at it. It's not the way we should look at it. We should have passed it tonight. We should have passed it to help protect some of the most vulnerable members of our society. Funding should be a top priority. Regardless of your partisan position, or regardless of the political climate, it should be out of the political fray. And I urge my colleagues, when we come back after the first of the year, let's make that a priority. Let's bring it to the floor. Let's have a vote. Let's keep it bipartisan. Maybe it could even be unanimous. And let's give those families in Ohio, the 219,000 kids who depend on it, and the millions of families around this country, the peace of mind to know that, yeah, we're extending this program. Let's do that 5-year extension, that 5-year authorization that we've already passed in committee. Let's take it out of this political process and put it where it belongs, which is an issue that every single member of this body should want to address for the kids they represent. Again, Mr. Chairman, I appreciate the opportunity to speak tonight on the tax reform and tax cut legislation that I do think will provide the opportunity for everybody I represent to have a better future and a brighter future. And I appreciate the opportunity to talk on the Children's Health Insurance Program.